I have a lot of guys who wait and wait and wait and wait. They have an enlarged prostate and they don't get treated. So what can happen? Normal bladder looks like this, normal prostate, wide open channel, but then when you have an enlarged prostate that's pinching and blocking the flow of urine, the bladder is surrounded by muscle and it's trying to squeeze, squeeze, squeeze to get urine out. If you don't take care of this blockage right here by the prostate, you see these little lines and tissue that grows in the prostate, those are called trabeculations. When I look inside the bladder, I see that often, and if you have had a cystoscopy by me in the office, I show you what I see. That's scar formation in the bladder. You won't be able to see it just normally unless someone looks in with a telescope, and that scarring does not go away. Once it happens, it is irreversible, and that causes changes within the bladder, and then your urinary symptoms end up being stuck that way. And the worst case scenario is your bladder ends up quitting completely. You no longer have the ability to squeeze and empty your bladder. So what happens at that time is you have to wear a catheter all the time, or you put a catheter in 6 times a day to help yourself empty your bladder, or I put a tube through your belly and then you have a bag draining your bladder all the time. Even worse, rare, thankfully, urine backs up so badly in the bladder, goes up to the kidneys, ending up hurting the kidneys, the guy ends up on dialysis. Unfortunately, I've seen a few cases, and the bladder is obviously at that time completely flaccid. Not only do you have trouble emptying, you have kidney failure, which is just a bad combination.